Hello, my name is Anna Shu, and I am a member of the Rice American Lung Cancer Screening Initiative, or RALSI as we like to call it. Today, we will be giving a presentation on lung cancer and lung cancer screening with a special focus on lung cancer in the LGBTQ+ community. With me, I have Priyanka Senthil, the president of the Rice ALCSI team. We are grateful for the opportunity to present to you today. Oops, sorry. Before we get started, I'd like to request that everyone is muted during the presentation. However, we would love to take any questions at the end of the presentation, so please feel free to put your questions in the chat box for us to address. If you're interested in learning more about RALSI or ALCSI, we'd like to invite you to visit our website at www.ralsi.org, and please email us with any questions at any time. So before I get into the content of the presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. ALCSI is a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. We are a team of over 70 passionate students and doctors located across the United States. We've worked with community organizations like the South Asian Network and American Indian Cancer Foundation, as well as city and state health departments, including the NYC and Connecticut health departments. We hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. RALSI is a chapter of ALCSI at Rice University. With the same purpose of raising awareness about lung cancer and lung cancer screening, we focus primarily on the Houston community, working with Houston High School's community centers such as the Montrose Center and more. Today, we will discuss both lung cancer and lung cancer screening, addressing questions such as how common is lung cancer, what is lung cancer screening, and how can you get screened? So to begin with, lung cancer is very common. It is the second most common cancer in the United States, excluding skin cancer. This graph shows the American Cancer Society estimates for the number of new cancer cases in 2022 in the United States for the 4 most common cancers. As you can see, it is estimated that 236,740 people will be diagnosed with lung cancer in 2022 in the United States. It is estimated that about 6% of people will develop lung cancer during their lifetime in the United States. That means about 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. Moreover, not only is lung cancer very common, it is also very fatal. Lung cancer is the leading cause of cancer-related death in the United States and the entire world. So not only is lung cancer very common, it is also very fatal. Lung cancer is the leading cause of cancer-related death in the US and the world. In 2022, it is estimated that lung cancer will claim the lives of 130,180 people. This graph shows the American Cancer Society estimates for the number of cancer-related deaths in the United States. As you can see, lung cancer is far more fatal than breast, prostate, and colon cancer combined. Lung cancer makes up almost 25% of all cancer deaths, resulting in about 350 deaths every day. Every year, there are about 50,000 more new cases of breast cancer, but lung cancer causes over 90,000 more deaths. So if we look at lung cancer incidence and mortality by sex and race, you can see that among males, lung cancer incidence is highest in Black males, at an incidence rate of 71.7 per 100,000 people. Among females, lung cancer incidence is highest in white females, at an incidence rate of 51.1. Mortality rates mirror incidence rates. So Black males have the highest mortality rate amongst males, while white females have the highest mortality rate amongst females. Now, you might be wondering, how does lung cancer affect the LGBTQ+ community? According to the Lung Cancer Association, the oppression and discrimination that the LGBTQ+ community faces has led to disproportionate health risks, including a greater risk of substance abuse. There is a higher percentage of individuals in the LGBTQ+ community that smoke, and thus higher lung cancer incidence and mortality as well. Currently, about 1 in 5 LGBT adults smoke cigarettes, compared with about 1 in 7 heterosexual or straight adults. When looking at transgender adults, the percentage of cigarette smokers is 35% higher than that of straight adults. A 2019 Centers for Disease Control and Prevention, the CDC, Youth Risk Behavior Survey saw that over 10% of lesbian, gay, or bisexual high school students smoke cigarettes. That is more than 2 times the percent of their straight peers. Furthermore, older people in the LGBT community face a greater disproportionate cancer risk due to a longer usage of tobacco, alcohol, and other substances. These higher smoking and vaping rates only further hurt the community, as this puts our LGBTQ+ friends and family at a higher risk for chronic lung disease. According to the FDA, the causes of the disparity include both psychological and environmental factors, such as internalized homophobia, stress due to societal stigma, and negative reactions to their disclosure of sexual orientation. Furthermore, LGBT individuals are 5 times less likely to call a smoking cessation quit line. So from the previous slides, the question that arises is, why is lung cancer mortality so high? Well, lung cancer mortality is so high because patients are typically diagnosed at a later stage. So this is a graph looking at the proportion of patients with lung cancer by stage. Stage is a way for doctors to classify a cancerous tumor based on tumor size, if the cancer has spread to lymph nodes, and if the cancer has spread to other locations in the patient's body. Currently, most lung cancers are diagnosed at a distant stage, when the cancer has spread beyond the site in the lung where it originated. This graph is based off of data from 2008 to 2017, published by the National Cancer Institute. As you can see, about 21% of patients are diagnosed at a localized stage, while about 51% of lung cancers are diagnosed at a distant stage, where the cancer has spread to other locations in the body. So why is this important? It's important because the stage that lung cancer is diagnosed at correlates directly with survival, and we'll see this on the next slide. So one way that doctors track the survival of patients is by looking at the 5-year survival. As you can see here, the 5-year survival for lung cancer at the early stages is high, but the 5-year survival significantly drops as the disease progresses. This graph is another way to understand the relationship between the stage at diagnosis and 5-year survival. The 5-year survival for patients with localized lung cancer is 59%, but only 23% of lung cancers are diagnosed at this stage. In comparison, nearly half of lung cancers are diagnosed at a distant stage. And this is why early detection of lung cancer is so important. If we can detect lung cancer at an early stage, then treatment options are better and prognosis is better. With lung cancer being such a morbid disease, some of you might be wondering why the majority of lung cancers are diagnosed at a later stage. The majority of patients are diagnosed with late-stage lung cancer because they don't start feeling any of the symptoms of lung cancer until the cancer has already grown and spread. The most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. Additional symptoms may include hoarseness, loss of appetite, fatigue, persistent low respiratory infections, and a new onset of wheezing. However, when people become symptomatic, the cancer has grown and spread to a point where it is more difficult to treat and the prognosis is poor. If the diagnosis of lung cancer has to wait until the patient has symptoms, it is difficult to catch the lung cancer early. So the question we ask is, how do we catch lung cancer early if patients are asymptomatic? Well, one of the best ways we can do this is through lung cancer screening. So lung cancer screening is done using something called the low-dose computed tomography scan. If you're eligible for lung cancer screening, it is recommended that you get an annual lung cancer screening. In the coming slides, we'll discuss what lung cancer screening is, who should get screened, and how to get screened. So an important distinction we want to make is that lung cancer screening is done using low-dose computed tomography, which is also known as a low-dose CT scan, and not the chest X-ray. We use low-dose CT scans because it provides more detailed pictures than chest X-rays, and it is better at finding small abnormal areas in the lungs. The picture on the left is a picture of a chest X-ray. The yellow arrow points to the abnormal area in the lungs, but it is very unclear as to what it is. So the U.S. National Lung Screening Trial was a large national study with over 50,000 patients. The goal of the study was to determine the effectiveness of using a low-dose CT scan to detect lung cancer in patients considered high risk for lung cancer. And as you can see, of everyone diagnosed with lung cancer, the low-dose CT scan still caught the most lung cancers at an early stage, while the X-ray diagnosed more patients at stage 4. This has important implications for survival. Because the low-dose CT scan caught more lung cancers at an early stage, these cancers were more likely to be treatable and the prognosis was much better. This translates to a 20% reduction in mortality for those who underwent lung cancer screening using low-dose CT compared to an X-ray. So lung cancer screening significantly reduces lung cancer mortality, but who should get screened for lung cancer? The United States Preventative Services Task Force, also known as the Uspstf, sets guidelines for who should be screened for lung cancer. Right now, they recommend that people between the ages of 50 to 80 who have a 20 pack year smoking history or greater and who are current or former smokers who quit within the past 15 years get annual low-dose CT scans. The current screening guidelines require you to have a 20 pack year smoking history. A pack year is probably a term that most of you have not heard before, but it is just a way for doctors to track your smoking history over a period of time. So it is defined as smoking a pack of cigarettes per day for a year. For example, if you were to smoke 1 pack a day for 20 years, that would equate to a 20 pack year smoking history. Alternatively, if you were to smoke 2 packs a day for 10 years, that would also equate to a 20 pack year smoking history. The important takeaway is that there are many different ways to reach 20 pack years, and the pack year is a way to help doctors track your smoking history. I'd also like to point out that the Uspstf Guidelines were recently updated. So if you have been told previously that you do not qualify for lung cancer screening, that may be different with these updated guidelines. The Uspstf updated their screening guidelines on March 9th, 2021. The previous screening guidelines only recommended that individuals between the age of 55 to 80 with a 30 pack year smoking history or more get screened. Under the new guidelines, the lower age bound is lowered from 55 to 50, and the pack year smoking history is lowered from 30 pack years to 20 pack years. These new guidelines will nearly double the number of eligible individuals for lung cancer screening in the United States. Notably, the most apparent increases in eligibility will occur among women and minorities. However, while these new guidelines will include more high-risk individuals, they only include individuals with heavy smoking histories. There are other risk factors for lung cancer that are not accounted for in the current screening guidelines. These additional risk factors include exposure to secondhand smoke, exposure to radon, exposure to asbestos, family history of lung cancer, COPD, and previous radiation therapy to the lungs. It is important that we recognize these additional risk factors. While lung cancer has a strong association with smoking, there are a large number of people in the United States who have never smoked that still get lung cancer. So never smokers are defined as individuals who have smoked less than 100 cigarettes in their lifetime. Because lung cancer has such a strong association with smoking, people are often surprised to learn that lung cancer in never smokers accounts for about 10 to 20% of lung cancer diagnoses, and is the 7th leading cause of cancer-related death in the US and the world. More never smokers die from lung cancer each year than people die from ovarian cancer. So this graph shows the proportion of lung cancer cases that occur in people who have smoked in their life and people who have never smoked. It is then further broken down by whether they are a current, former, or never smoker. As you can see, 80 to 90% of lung cancers occur in people who have smoked during their lifetime, and about 10 to 20% occur in never smokers. Interestingly, women are more likely to be never smokers when diagnosed with lung cancer. In fact, in the US, 60 to 70% of never smokers diagnosed with lung cancer are women. Right now, lung cancer screening is not recommended for individuals who have never smoked. However, understanding lung cancer in never smokers is a current focus of research. With the development of new screening technologies and risk models, there may be a way to identify high-risk never smokers who should be screened for lung cancer. So in summary, lung cancer is the leading cause of cancer-related death in the US. It is so deadly because most lung cancers are diagnosed at a late stage when they have spread to other locations in the body. Importantly, early detection through lung cancer screening by the use of low-dose CT can reduce lung cancer mortality by up to 33%. So currently, only 5.7% of high-risk individuals are currently getting screened for lung cancer. To highlight how low this number really is, we compare the lung cancer screening rate to the screening rates for breast, cervical, and colon cancer. All 4 of these cancers have screening tests that are recommended by the Uspstf. Right now, only 5.7% of high-risk individuals are getting screened for lung cancer, as previously mentioned. This rate is extremely low in comparison to the screening rates for breast, cervical, and colon cancer. The American Lung Association estimates that if we were to screen every high-risk individual recommended by the Uspstf in the world, we would save 48,000 lives. However, because we are only screening 5.7%, that means that a lot of lives that could be saved are not being saved. So even within the LGBT community, there are health disparities in lung cancer screening. And in an analysis from the 2018 Behavioral Risk Factor Surveillance System, it was found that there are sex-related and sexual identity-related disparities with lung cancer screening among US respondents between the ages of 55 and 79. Among individuals who were born male and female, lung cancer screening was greater for those who had fair or poor general health and had no medical cost burden. Individuals who were born male and identified as gay were also more likely to be screened for lung cancer. On the other hand, individuals who identified as bisexual and were heavy drinkers were far less likely to be screened for lung cancer, even though the smoking rate is highest among bisexual individuals. So the lung cancer screening rate is low for a number of reasons, including limited awareness and concerns about access to screening, the cost of screening, and the safety of screening. In the next slides, we will discuss each of these topics. The important takeaway, though, is that lung cancer screening can help reduce an individual's risk of dying from lung cancer. The first potential concern we will address is the cost of lung cancer screening. The average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. However, there are a few exceptions. Medicare will only cover lung cancer screening under the age of 77. Not all state Medicaid plans cover lung cancer screening, and patients will still pay the usual fees for provider appointments before or after the scan. So as I just mentioned, unfortunately, not all state Medicaid plans cover lung cancer screening. Here's a map updated in September 2021 showing which state Medicaid plans do and do not cover lung cancer screening. Blue states have state Medicaid plans that cover lung cancer screening. In purple states, their state Medicaid plan does not cover lung cancer screening, and in pink states, this particular information is not available. As you can see in the graph, Medicaid covers the cost of lung cancer screening here in Houston. So the first step to getting a patient screened for lung cancer is having them talk to their primary care provider. There are certain questions a primary care provider has to ask and topics that have to be discussed. One of these is the patient's past year smoking history, which we saw how to calculate in earlier slides. Information on the patient's exposure to smoke within the household or outside of it should also be discussed. If you think you may be at risk for lung cancer, talking to your primary care provider to decide your plan of action is important. And to find accredited lung cancer screening centers, patients can go to the American College of Radiology website. They can type in the state or city they live in to see where accredited lung cancer screening facilities are located near them. The American College of Radiology website is listed on the bottom left-hand side of the screen. This is a map of accredited lung cancer screening facilities in Houston. As you can see, each red pin represents an accredited screening center. As far as how the experience of getting a low-dose CT scan goes, it will require you to lay on your back for about 5 minutes. You'll be doing something very similar to the patient in the photo here. One thing to note is that this process will not hurt at all, and because this is a low-dose CT scan, there will not be any needles or injections involved. The low-dose CT scan is non-invasive, fast, and completely pain-free. Additionally, the amount of radiation exposure is very low. A low-dose CT scan exposes you to less radiation than you are exposed to from just existing on Earth. The level of radiation you receive from an annual lung cancer screening test is very small. And that being said, this is always something that patients can discuss with their primary care provider. So a patient talked with their primary care doctor, and the primary care provider referred the patient to a screening center, and they reduced a low-dose CT scan. After that, the doctor will receive the results of the patient screening test and will follow up with the patient to go over the results. As far as the results go, there are 3 most likely outcomes. The first outcome is that the scans are normal. If this is the case, then the patient should look to get repeat scans in a year. If the scans are abnormal but probably benign, then the patient should talk to their doctor about the next steps. This may include more scans, tests, or biopsies. And if the scans are abnormal and suspicious, then the patient will most likely have to undergo additional testing, such as a biopsy. So lung cancer screening saves lives, but a question you may be wondering is, can individuals still get screened for lung cancer during the COVID-19 pandemic? And is it safe to do so? During the pandemic, the number of cancer screenings has decreased significantly. quickly. However, lung cancer won't stop because of the pandemic. If a patient is at high risk for developing lung cancer, it is important that they get their annual lung cancer screening test. Right now, most hospitals have operating lung cancer screening programs, and patients can wear a mask during the entire lung cancer screening process. If patients follow the necessary precautions, like wearing a mask, lung cancer screening during the pandemic is safe. The pandemic should not deter patients from getting screened for lung cancer. Another question we often get is how vaping and e-cigarettes use affects lung cancer risk. Vaping and e-cigarettes are relatively new phenomena and have become more prevalent in the last decade. While the long-term effects of vaping and e-cigarettes are still being studied, it is clear that, for individuals who have never smoked before, they can increase their risk of lung cancer. E-cigarette devices and vaping fluids contain nicotine derivatives and heavy metals, among other chemicals. These arise both as elements of the e-liquid and as a result of organic reactions in the electronic cigarette device. Various studies demonstrate in vitro transforming and cytotoxic activity of these derivatives. Vaping causes fewer health risks than smoking, but it's not a risk-free activity. Vaping can increase heart rate, decrease air volume in the lungs, and increase airway resistance. Furthermore, e-cigarette device use has been significantly increasing, particularly among young adults and non-smokers, making it an area of significant concern for the future. Additionally, while lung cancer screening has the potential to save many lives, it is important to address smoking cessation in the context of lung cancer screening. Likewise, lung cancer screening is not a substitute for smoking cessation. Likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is the best way to detect lung cancer early. Using both is the best way to fight the disease. For every year after an individual quits smoking, the risk for lung cancer is reduced by 8% to 17%, depending on the kind of lung cancer they have. Another reason that smoking cessation is important is because it is required by Medicare and Medicaid services for lung cancer screening programs. However, we do understand that smoking cessation can be difficult. There are a lot of great resources for people trying to quit smoking. One great program is the American Lung Association's Freedom from Smoking program. We also want to recognize that there are even bigger barriers to care for the LGBTQ+ community. While tobacco use rates are 40% higher in the LGBTQ+ community than in others, this is not the only factor that contributes to the increased incidence of cancer in this community. In addition to fewer LGBTQ individuals feeling comfortable to reach out to a smoking cessation quit line, 60% of oncologists don't feel that they know enough to treat LGBT patients. And 80% of oncologists don't feel that they know enough to treat trans patients. Therefore, in order to improve both lung cancer treatment and healthcare in general for LGBTQ+ patients, it is critical that we prioritize education, training, and awareness for oncologists and physicians in all fields of medicine. So as this presentation comes to a conclusion, we want to end on what we, the American Lung Cancer Screening Initiative, along with the RICE chapter, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase the lung cancer screening rate. Lung cancer is the deadliest cancer in the world, and while lung cancer screening can save so many lives, very few high-risk individuals are currently getting screened. We are working to address all aspects of this issue. We wrote and advocated for House and Senate resolutions expressing support for Lung Cancer Awareness Month and early detection through lung cancer screening. In December of 2020, our Senate resolution was passed by unanimous consent. Additionally, we are working to teach communities across the country about lung cancer and lung cancer screening, such as our presentation here tonight. Lung cancer is the deadliest cancer in the world, but by working together, we can overcome it and save millions of lives. It starts by working together to raise awareness and initiate lung cancer screening programs in our communities. We believe that educating communities, especially students, about lung cancer and lung cancer screening is crucial to lowering the number of deaths associated with the disease. Students greatly impact and influence the healthcare of their parents, and we hope that by educating students about important measures that can be taken, we will not only be able to help the students, but also their family members. So here are a couple of our upcoming events about lung cancer screening at community centers and schools in the Houston area. Thank you so much for listening, and I would like to now open the floor up to any questions that you guys may have. We welcome any and all questions. Thank you.